We're so done with new year, new you. This year, it's more you on Bumble. More of you shamelessly sending playlists, especially that one filled with show tunes. More of you finding Geminis because you know you always like them. More of you dating with intention because you know what you want. And you know what? We love that for you. Someone else will too. Be more you this year and find them on Bumble.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to my third in the new series I'm calling Mo's Monday Minute, where I share a quick tip to help you be an even more amazing nurse or nursing student. And this one is about clustering care. So as a nurse, you've probably already figured out, even if you've only been a nurse or a nursing student for 5 minutes, you have figured out that you probably always have about 20 things on your to-do list. And the only way to get them done is to cluster your interventions and cluster your assessment. So here are a few examples of ways you can cluster and be more efficient at the bedside, because it's all about being super efficient so that you can save as much time as possible for the most important things. So here's a great tip for you. If physical therapy is coming to get your patient out of bed for the first time, let's say they had their hip replaced and PT's coming to get them out of bed, bring the bedside commode and combine toileting with this crucial first physical therapy assessment. In fact, I would do it every time the physical therapist comes by, because why not, right? Toileting and activity all at the same time. It gets the patient's toileting needs met, and it helps the physical therapist see how well they're doing with this basic ADL, or activity of daily living. The patient's going to appreciate not having to use a bedpan, because that's no fun, and also get some practice from sitting down and then standing from a seated position. Another one is if your patient needs that morning insulin, check your blood sugar when you perform your AM vitals or your head to toe, whatever you're doing at that time, and then bring the insulin in with you with their tray. While you're there, get them up to the chair, because we always want our patients out of bed for meals when we can, and teach them how to perform some ankle pumps. So right then I'm doing my blood sugar check with another assessment like my vitals or my head to toe. And then I'm giving their insulin when I bring their tray in. So they're going to get their insulin and then they're going to start to eat. And I'm going to get them up to the bed, the bedside chair, and teach them ankle pumps. I've done like 5 things in that one patient interaction. What about when your patient needs a bath? You might as well do your wound and skin assessments at that time, change the linens at that time, and perform any focused assessments that you need to. I also find this is a great time to freshen up the room while I'm at it. So I'm never just going in there to do one thing. I'm trying to do as many things as I can all at once. Another time might be when you could cluster is when it's time to check your tube feeding residuals and flush the tube feeding tubes. Check to see if it's also time to change the tube feeding set itself. This is also a great time to assess the insertion site, and why not grab a set of vitals if they are needed. So again, always be thinking about, okay, I'm going into the patient's room to do X. Can I do A, B, C, D, and E while I am in there as well? And that will help you cluster your care. It'll help give the patient some periods of rest, and it'll help you be more efficient and get more done. Thanks for joining me for this Mo's Monday Minute, and I will see you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Do you find it hard to sleep at night? Then the Sleep Cove podcast can help you. Hi, I'm Christopher Fitton, the voice and clinical hypnotherapist behind Sleep Cove. Sleep Cove features sleep hypnosis, meditations, and bedtime stories, all designed to help those of you who struggle at night to achieve a restful and peaceful night's sleep. Search for Sleep Cove on Apple Podcasts or Spotify and see why Sleep Cove helps millions of people sleep deeply all night long.